Facebook too?
We are live now.
Great.
So hi, this is Amy Landau from North Shore Acupuncture, and this is part of a series called Perimenopausal in a Pandemic, and we are just covering different topics that people face or positive things they go through during perimenopause. And today our focus is on pelvic health. So I have two experts here joining me to talk about that. I have Suzanne Badillo and Judy Florendo, who are both from Link PT. So they are physical therapists who specialize in pelvic health. They can help you with other things as well, but have a specialty in the pelvic area. So thank you for joining me today.
Thanks for having us.
Yeah, it's great to be here.
So if you are joining us and you have questions, feel free to put those in the comments and I'll make sure that we cover those questions. If you watch this later, you're not able to watch it live, still put your comments in and questions and I can try to follow up and get an answer to you for that as well. So there's lots we could talk about here. One thing we want to mention is that there actually is at 12 o'clock our time, Central Time, there is a movement where healthcare practitioners are going to be kneeling in respect of the Black Lives Matters movement. So we are going to try to wrap up so that we can participate in that. But we will try not to rush anyone's questions if they have questions. So first, if we could talk, could you guys tell me a little bit about some of the most common problems you see women that are in perimenopause or menopause? What are they coming into you about?
Sure. We are very often seeing women that complain of painful sex. Might not have been painful ever in the rest of their lives, but now it is. Sometimes urinary incontinence. They will talk about that maybe they had that earlier after they've had babies, it went away, and now during menopause it seems to be creeping back. Sometimes women are talking about a urinary tract infection that keeps recurring or other bladder symptoms. And Suzanne, you can tell them what the new term for this is, the whole constellation of symptoms.
Yeah, so what's maybe good to point out too is, as you probably have talked to, other practitioners about, menopause happens over a period of time. So it's not like you just wake up and all of a sudden you're in menopause or anything like that. So sometimes this is more in hindsight where we'll talk to our clients and we may realize that all of these things have been happening over time. And it's hard because it's this transition that they may be going into menopause, maybe also overlapping with postpartum, where their hormones are also changing at that time. So it's possible that someone could be perimenopausal and postpartum kind of in the same period of time. So a lot of these things happen also at that time. It's just hard to say what can we say is menopause related. So know that there's a lot of overlap. But once we can see, and once practitioners can see, a lot of these symptoms that Judy was talking about is probably more because of the changes that happen with menopause. They may actually be termed with a condition that's called GSM, which is genitourinary syndrome. So that's the more newest, more current terminology for this condition, where it's all of those things at once. It's affecting sexual health, bladder and bowel health, vulvar, vaginal tissues, all of those things together could be all termed into that, which is actually more helpful in the healthcare field, because then people can know what to do about it. We can actually help with it.
So those are really the overachievers, the women that are postpartum, perimenopausal, in a pandemic.
Right, aunties, yeah, right. In a pandemic, right.
So you mentioned that there's things they can do, so they don't just have to deal with it. Can physical therapy help with those things?
Absolutely. For the one symptom of painful intercourse, we call that dyspareunia. But women tend to think that this is just an issue of lubrication. And so maybe they've tried every lubricant in the book and they still come back and they'll say, I've done all of these things, it's really not helped. So what else can we do? What is this about? It's not just about lubrication, but the tissues actually change. I sort of lighten the moment when I'm with somebody, working with somebody, and I mentioned that when we're 19 years old, the tissues, the lining of our vagina is very much like a thick Tempur-Pedic mattress. That's when you're very young. And then once you get around menopause, it sort of becomes like a futon. So it's about tissue thinning, and the integrity of the tissue actually changes because of the hormonal changes. So if we can try to do some things to influence blood flow, and Suzanne can go into some of that as well and tell you about that now.
Yeah, so I mean, going along with the tissue changes, that's why oftentimes things like urinary incontinence and those bladder symptoms like UTIs and urgency frequency, that also could be affected by these tissue changes. So most people do ask, like, what could you possibly do in PT, and things that improve blood flow and tissue integrity and resiliency are things that we do for other parts of our body that help too, like exercise, and stretching and some manual techniques. Like if you think of any other part of our body that might happen to, we could do the same for the pelvic area too. And so, that is where we come in and do a really thorough exam. And part of the exam is being very specific with the client on her story, her history, her medical history, her birth history. We know that has a lot to do with her risk factors for pelvic floor problems later on. There was actually a bunch of studies recently in the past few years where they're looking at time after childbirth and what might happen, and incidence or peak times for urinary incontinence and prolapse, which is where there's more of a descending of the organs. And one of the studies was saying the peak time for urinary incontinence after delivery is actually 5 years post. And then for prolapse, it's 15 years post, which is, we think like, oh yeah, right after having babies, that's when you have the most problems, but this happens over time. So knowing the history, no matter what we're seeing them for, is going to be really important, as well as any gyne history, urological history, GI history, any trauma, back pain. So that's where we would do have a good understanding of what's going on, and then do a musculoskeletal exam. So taking a look at not only just their pelvis, which we can go into, but all the neighboring tissues like the hips and the abdomen and the back and the spine, the shoulders, the feet, all of that is connected. It's actually why we call ourselves Link, right, Judy?
Right.
When we were trying to figure out a name for our practice, when we were, coming together and trying to figure out, okay, what makes us different? What is this that we do, that we specialize? And really the thing that we're really passionate about is linking all of these parts together to understand the whole person, So, even though someone's coming in for one specific thing, we may need to know all those parts of their story to really get a better understanding of what's best to address it, So,
right.
So that's a big part of it. And then, more specifically for the muscles, understanding what's going on with the pelvic floor muscles, which is what most people want to know. Like, what is that? Like, what do we do with that? Go ahead, Judy.
No, I was just going to say, so, with that, a lot of times people will say, is it best for me to do pelvic floor exercises? Do I need to go back to doing Kegels? And in some cases, it might not actually be the best thing to do. If you have already been dealing with some issues of pain, perhaps you even have layered on top of that some urinary incontinence, these muscles might always be in a state of, I use my shoulder sometimes, sort of a protective clenching. And then in that case, it's probably not a good idea to do a lot of Kegels. You might actually make your pain problem worse. So this is where, as Suzanne was saying, if we really look at the person in toto, we can figure out, what is the best avenue in to help with this particular issue, even though it might seem like, I don't understand the relationship. It's our job then to make you understand what the relationships are. So,
yeah, that's one of the things I read was that for some people, Kegels can actually make it worse. that doing a Kegel alone is kind of like if I did a bicep, I guess you can't see my arm, but if I did bicep work like this and I never brought my arm all the way down,
Right.
Exactly.
I'm causing it to be like this.
Yeah.
So that's even, Suzanne, you mentioned there's risk factors that make you more likely to have this. So ideally, we would all like to do preventative medicine.
Mhm.
So even for someone that's younger, it might make sense to see you guys so that you could evaluate their risk factors, show them the correct exercises to do preventatively so they don't cause problems when they're trying to prevent problems.
Absolutely. Yeah, that's a big message that we'd love to, share, is that you don't have to wait until there's a problem to really do anything about it. There's a lot of things you can do way early in life to prevent. And like you said, identifying risk factors, we're not going to not do certain things, because we know it's a risk factor. But what can we do knowing that those are part of our story, that we can help us later? It's like, I always term it as, or liken it to other parts of our body. We know playing sports is a risk factor for certain muscle injuries or knee injuries or whatever it is, but doesn't mean we're not going to do it. But we can strengthen, we can make sure that if we do have any issues, we target it right away, stretch. There's a lot of things that we know to do to help our fitness and our overall wellness for other parts of our body that we can own, and we can take control over. So why not the pelvis? Why is that something that we just have to wait and see, and hopefully we are on the lucky side and not have those, So there's things that we could do, you're right, early on, knowing that those are parts of the, those are contributing factors.
And I know there's a lot that goes into the history, but are there a couple of key things that, if I see someone that has this, like they had leakage after their pregnancy when they laughed or sneezed, or are there things that I could look for to say you should go see them now before it becomes a bigger issue?
Yeah, that. So, those are, and Judy and I have talked about this and spoke about this a lot. Of one is, for as many years as we've been in practice, one of the things that we even now continue to hear is, I thought that was just normal, or I thought this was part of it. I thought that was part of being a woman or aging or having a baby, or sex was supposed to be painful, or whatever it is, all those things where no, it's not. And so when you identify it, whether you're the practitioner, you're a friend, you're the person, your partner, those are important to actually say, you should get some, address it and get evaluated for it. Because the earlier that you can see somebody about it and talk about it, the earlier you can actually kind of nip it in the bud.
You're right. I see so many people, because it's a question I ask, just part of my normal intake. And when I tell people that they can do something about that, and I mention you to say, if the acupuncture does, I will do needles for that. But I'm like, if that isn't enough, you need to see. People are surprised because, like you said, they just think it's something they have to deal with.
Right. And so much of what we do actually is myth bust. We are myth busters, and a huge part of the initial appointment or two will be education. And it's really very eye-opening. There are times that Suzanne and I have gone to speak, and we might even start out our talk with women asking questions like, how many times a day do you think is normal for you to make a trip to the toilet? And you get a huge variety of numbers. And then when we start to talk about what is considered normal, there are a lot of really, you hear lots of whispers like, oh my goodness, it's really fun to be able to bring these info points to people, and they start to think a little bit differently about habits.
Yeah. Mm-hmm. So for those of you that have just joined, we're talking about pelvic health. And if you do have any questions, go ahead and put those in the comments. Are there anything that you are seeing right now related to the quarantine? I know I'm sitting a lot more.
I was just going to say sitting, Amy. Yeah, when Suzanne and I were talking about this yesterday, it's people are baking a lot and eating a lot, cooking a lot. So, but they're not moving as much. And then on top of that, they're at home working more. I know that there have always been a lot of people that work from home, but I think this combination has really created a situation where, you're not getting good blood flow to this part of your body, right? The perineum down there is just compressed. These tissues are not very happy. They're not getting good oxygenation. So yeah, it's definitely, I think, pandemic is exacerbating things.
And there's also changes in their daily activity or daily schedule, if there is even one, or lack of structure, or even more structure. So some people are homeschooling, some people are actually much more regimented now that they have the ability to go and eat when they want to and go to the bathroom when they want to. So big changes, but that change affects someone's bowel and bladder habits too, and their routine. And it's interesting, and then on top of it, the layer of stress, which could be a whole nother series, I think. But that also, as Judy was saying, that tension of the muscles, we carry our tension in different parts of our body at different times. And some people predominantly carry it, maybe in their shoulders or their head or their gut. Some people carry it in their pelvic floor, and so whatever the other external factors are, that might be where their source of physical tension might feel, where it's identifying that and learning that might be something they can control too is something that we've been working on with people even virtually in their own home, because they're all these things that are going on in the world, the tension's carried somewhere. Sleep is off, which I know that's your expertise, and so we talk a lot about that and talk about you, but that also affects their own system and all of the things that we're working on with their pelvis as well. It's really interesting.
Right, and we really see a good collaboration here with you and other practitioners. For instance, for the woman that is talking about, all of a sudden now I have to go to the toilet 12 times a day. I feel urinary urgency. There are the things that we can do as physical therapists to help with that as well. But very often we do refer to you for getting some needles to help with that urinary urgency. I think that's pretty important. So kind of, a multidisciplinary approach is good.
But, we found that too, and this is something way before the pandemic, but now even more an opportunity during the pandemic of just the basic health habits and basic lifestyle habits, how important that is for overall health, especially with the gut and all the pelvic stuff that we do. But the basics of diet and sleep and exercise and hydration, and stress management, that's in the literature now being much more supported by the evidence on, unless you have that strong foundation, all those other things, it's really hard to address. So there could be more of an opportunity when people have possibly more time and flexibility at home to know where to focus in terms of getting their own health and wellness up and their immunity up and their strength and resiliency, like get those basics down, which affect everybody and all of us. But those things we're seeing in our own practice as being, again, really common things that we try and reinforce in what we do.
Yeah, that's a good summary, really, of all of the sessions. And if you have that baseline, you're much less likely to have some of the negative symptoms that people experience.
Yes, the baseline. Yes. That's been one of the things I've been trying to kind of figure is how do we improve our baseline, right? It's just like our baseline health, no matter what happens, and whether it's in the pandemic or in life, if we have a stronger or more healthy baseline, then we're more resilient to whatever is going to happen,
So we've talked about, you already mentioned telehealth. So how can people work with you right now? Are you only doing telehealth, or are you going to start seeing some people in person? What's happening? And I want to make sure people know that, first of all, it's not only menopausal women that you see. You also see men. You see a lot of bowel and urinary issues as well. So if you could talk more about your practice, because someone might be on and their husband is struggling with incontinence as well, or constipation. So.
Mm-hmm.
Right. Yeah. No, we will be opening officially next week. I know Suzanne's actually saw an in-clinic patient this week. Mm-hmm. So we're going to be really doing this combination of in-clinic and telehealth still, because I think they really complement each other. And we can do a lot of our education, even exercise we can do virtually. So I think that we're very excited about getting back in there to see our patients. Our patients miss us. And then there are Allison Black, our admin, has been telling us that we're getting a lot of phone calls from new patients. So I think everybody's ready to open up.
Yeah. And we, the things that we've been working on is trying to be safe with, as most people with the reopening. And I think, that's what even though we could have been open this whole time, the things that we've really tried to put in place is not only our own procedures, but securing enough PPE so that we have it for the amount of close work that we have to do. Our patients will also be provided with adequate PPE. We have a lot of protocols in place just to make sure that things are in line with our, the CDC guidelines. And so doing a combination of virtual and then when needed in person, that's where we're starting. We started this week, and then even more, we're more busy with that this coming week. But yes, and then to tie in with what you were saying before, we do see women, men, transgender individuals, as well as children with bowel and bladder issues as well. So as well as regular general musculoskeletal issues too.
Yep, because like you said, those are all linked.
It's all linked.
And I did want to put your website, so it's linkpt.org, right?
Correct.
Right.
Yes. Thank you. Yeah, and in there's under there's a lot of good information under wellness. There's a couple of great handouts that are there, or info sheets about what are some tips, like really easy tips you can do for pelvic health. There's actually a screening form that's there, a self-screening. So if you're trying to figure out, I don't know, should I see somebody? You can check it yourself and try it different times and, whenever, or forward it to somebody. And then there's a few blogs in there too that may be helpful just to get more insight on some of these specific things that we touched upon.
And check in with our Facebook page.
All right. I will make sure I link the Facebook page to this when we have completed. Are there any questions from the people that are on? If you have questions, you can put those in the comments. Suzanne or Judy, is there anything that we left out that we wanted to cover? I know you could talk for weeks.
Yeah, that's true. And I know that we all want to get out to the very important event out on Ridge Avenue there. So really, if somebody wants to chat with us further, please give us a call. We would love to talk to you virtually or by phone. So reach out.
Absolutely.
Right. Thank you very much for your time today. For those of you, if you've missed previous sessions, you can find them at perimenopausalinapandemic.com. So this one will be downloaded there as well. That might be the easiest place to find it. And we are rescheduling the hormone replacement therapy, yoga for bone health, and sexual health during the perimenopausal time. So watch my Facebook page for those rescheduled dates. All right.
Great. Thanks for doing this.
Thank you.
Take care.
Bye-bye.
Bye.
Bye.